Welcome to the Personal Hygiene module, which raises awareness of the importance of good personal hygiene at sea, including how to minimize chances of COVID-19 and other viral infections. While for most people a high standard of personal hygiene is the norm, it is arguably more important in the confines of a fishing boat. Not only does it help prevent the spread of air and foodborne disease and illness, but it prevents a common cause of conflict amongst crew members. It is also easy enough to let these standards slip when working long hours on deck and suffering from fatigue and exhaustion. In this regard, whilst at sea, it is essential that you shower regularly using soap and water. Wash hands and face with soap before handling food or eating. Wash hands with soap after using the toilet. Keep hair clean and tidy. Keep aprons and rubber boots clean, and regularly change and wash clothes. Keep the cabin, galley, bathroom and toilet clean and tidy, and do not leave food or food scraps in the cabin, galley or elsewhere, as this may attract vermin or insects. Bedding should be changed and cleaned regularly. Cuts, abrasions, and puncture wounds must be kept clean and covered with an appropriate dressing. On a fishing boat, skin boils and dermatitis can be a significant health issue and risk, particularly in a humid climate. Skin boils are caused by bacteria entering the body through broken skin, often due to abrasion with clothing, tops of rubber boots, or skin puncture by fish or prawn spines. Dermatitis is a skin condition caused by an irritant or allergic reaction in response to contact with seawater, fish juice or slime, seafood, or chemicals such as sodium metabisulfite. Skin boils can quickly be spread between individuals, especially between those working and living in close proximity. In more advanced cases, the infected person may need to leave the boat and seek medical attention on shore. The first step toward preventing skin infections is good personal hygiene and clean and hygienic living spaces and workplace conditions. This includes washing hands and other exposed parts of the body with soap and water after handling the catch. On some boats, a diluted disinfectant solution in a bucket by the galley door is one way to encourage regular cleaning of the body before leaving the deck. Other appropriate practices include not sharing towels, bedding, or clothing between crew, or personal grooming items such as razors, toothbrushes, or nail cutters. They include keeping wounds cleaned and properly covered with a dressing, and kept dry. And it includes taking any prescribed antibiotics, skin creams, or other medication in accordance with the doctor's instructions to ensure rapid recovery and to minimize the risk of infecting others. COVID-19 is a new strain of coronavirus that can cause serious illness or death. Other strains of coronavirus include SARS, MERS, and the common cold. Influenza, most commonly known as the flu, is caused by a different type of virus. Symptoms for COVID-19 include coughing and fever, and sometimes a sore throat, shortness of breath, fatigue, aches and pains, headache and a runny or stuffy nose. Some infected individuals suffer a loss of smell and/or taste. Note that many of symptoms for COVID-19 are similar to that for the cold and flu. While the flu can be spread more quickly than COVID-19, the proportion of severe and fatal COVID-19 infections is much higher than that for the flu. COVID-19, like other viruses, is spread by individuals in close contact, such as the confines on a fishing boat. Infection occurs through contaminated droplets spread by coughing or sneezing, or by contact with contaminated hands, surfaces or objects. The time between when a person is exposed to the virus and when symptoms first appear is typically 5 to 6 days, although may range from 2 to 14 days. For this reason, people who might have been in contact with a confirmed case are being asked to self-isolate for 14 days. Most COVID-19 cases appear to be spread from people who have obvious symptoms, although a small number of people may have been infectious before their symptoms developed. Studies suggest that coronaviruses may persist on surfaces for a few hours or up to several days. If you suspect being infected by COVID-19, you must self-isolate immediately. If at sea, you must follow the vessel COVID-19 management plan and inform the skipper immediately. You must also immediately contact the doctor, particularly if you have a fever, cough, sore throat, or shortness of breath. You will need to advise the doctor of your symptoms and any recent travel, so they can prepare your treatment and advise you of next steps. There is no vaccine for COVID-19, although early diagnosis and care is vital to your recovery. Many people with COVID-19 do not require hospitalization. The fatality rate is generally higher for those with compromised immune systems, chronic disease, and the elderly. Young people are not exempt from infection, and can spread the virus and infect those at higher risk. It is essential to take the following simple measures to reduce your risk of catching COVID-19 and of spreading it. Clean your hands regularly with soap and water for 20 seconds, or use an alcohol-based hand sanitizer, particularly after contacting surfaces outside your home. Cover your nose and mouth with a tissue when coughing and sneezing, or use your elbow, not your hands. Avoid touching your face and avoid shaking hands with others. Avoid close contact with people unwell with cold or flu-like symptoms, and stay home if you have these symptoms. Try to maintain a distance of 1.5 meters from others as much as possible, and avoid crowded places. In the confines of a fishing boat, it is essential for everyone on the boat actively take steps to prevent the spread of COVID-19. This includes everyone taking the previously mentioned preventative steps to avoid infecting others, such as washing hands regularly and coughing into your elbow. Avoid sharing cigarettes and personal items such as towels and toothbrushes. Cleaning surfaces with disinfectant on a regular basis, particularly bench tops, galley tables and seats, door handles, etc. On some boats, it may be necessary to self-isolate for 14 days prior to a fishing trip, particularly if you have been traveling and the boat is expected to be at sea for several weeks or longer. It is important that you take all steps possible to avoid contact with an infected individual whilst at port and between fishing trips. This includes avoiding bringing visitors or others on board the boat, unless absolutely necessary, immediately disinfecting all surfaces on the boat that any visitor has contacted, requesting the visitor to take appropriate safety precautions when coughing or sneezing, and to take all steps necessary to avoid contacting surfaces. Avoid going into town or other crowded location, to the extent possible, washing hands with soap for 20 seconds immediately upon returning to the boat, self-isolating between trips. Remember, you do not want to be responsible for bringing COVID-19 to your boat and affecting your health and that of others, perhaps fatally. As a final point, whilst everyone on board is responsible for their own personal hygiene, it is important and appropriate to remind others if their hygiene is inadequate. Body odor and smelly clothes can be particularly obnoxious and a major source of conflict. Skin infections from poor hygiene are highly infectious and debilitating, and while sick crew recover, healthy crew may have to pick up the slack. Viruses are also highly infectious, highly debilitating, and can even cause death. Excellent! You have completed the Hazardous Animals module. Let's now review the material that we covered.